folks, I'm here with another one of my patient members, Judy, and Judy's been in our program for I think about what, 6 months?
Since February.
Since February, so not even 6 months, it's just a few months. And do you remember why you came to see me initially?
Well, I've just gotten to the age where I'm 60 and I feel like I'm 80, or at that time. And I was going to a really good intuitive massage therapist and told her what some of my issues were, and I was telling her that I think part of it's probably the endocrine system.
Yeah.
And she muscle tested me and said, "You need to see Dr. Nelson." And so she said, "You really need to see him. He's really going to be able to help you." And that's how I got started.
You showed up at my doorstep.
She gave me the paperwork. I filled it out. And
yeah. So, had you seen any other medical doctors or been under any medical care prior to seeing me?
Not recently. I fired my last doctor about probably 4 years ago.
Okay. Yeah, you just weren't hitting it off?
No, I didn't want to do the pharmaceuticals.
Yeah.
And so I was really kind of trying to work through things myself.
Yeah.
And I found that it just wasn't working. I needed help. So
yeah. A lot of patients are that way. They come to see me after they've tried the pharmaceuticals. Those didn't give them the results that they were looking for, and they ended up actually feeling a little bit worse sometimes, so they look for alternatives. And they do end up here. So yeah, and I really remember the blood work that we did with you. We found some interesting elements in the blood work that turned out to be something that you had not known about forever. And we found that you had a little extra iron in the blood. And
actually a lot.
Yeah, we found that there was quite a bit of extra iron, and we talked about the ramifications of leaving that iron in the blood at that level. And over a course of the last 3 months, I guess, we've been able to reduce that iron to a normal level.
Right.
Which has been pretty, I think it's going to be very beneficial for you in the long run.
And I came in pre-diabetic, and now that's normal range. I came in with a toxic liver, and that's in a healthy range. I've been able to lose 15 pounds. I wasn't able to lose weight before, so.
Yeah, it's such a great thing to see my patients just kind of transform before my very eyes, and I know it's going to mean a lot down the road even as you start to even regain even further vitality and health. So we put you on a program. Was that program difficult for you to follow?
It kind of was.
Yeah.
But nonetheless, I stuck to it as closely as I could. I cheated occasionally, and it still worked.
Yeah.
But yeah, it's not the easiest program coming from normal eating to the restrictions. But the shakes are really tasty.
Yeah.
And really seem to do a lot of good.
Yeah, they do. They're a really great foundational element in our program. But I agree, when you do come from a certain style of eating, and then we introduce a new style of eating, those habits can be somewhat difficult to change. And once you do change them, you start to realize the results.
You do feel better.
Yeah,
yes.
yeah, and you end up improving your health so dramatically that if you do go back too far in the wrong direction, you notice the change then too. So, well, I really appreciate you taking the time here. I know you're a busy woman, and I just want to let everybody know that if they've got any of these chronic health conditions that they're looking to solve, make sure they give our office a call. Thank you.
I agree. Give the office a call. I am just so pleased with the results. I've been doing this since February, and I'm going to continue it until I have myself back in the shape that I want to be, and I know that Dr. Nelson can help me do that.
Thanks, Judy.